Hello, my name is Monty Ledbetter and I'm a nurse practitioner student at Auburn University. Today I'd like to talk to you about a drug class known as nitrates. This class of drug includes nitroglycerin, isosorbidine, dinitrate, mononitrate, and amyl nitrate. The action of the nitrates is that it affects oxygen supply and demand to the myocardium by providing more nitric oxide, which results in vasodilation. Some of the therapeutic effects of this drug is that it produces relief in angina pain, reduces cardiac workload, and decreases platelet aggregation. Some of the pharmacodynamics of nitrates: it causes vasodilation in the systemic vasculature. It reduces preload and afterload in the heart, and in the coronary vessels it prevents and reverses vasospasm. Some of the pharmacodynamics for nitrates: it is absorbed by the oral, buccal, sublingual, transdermal, and inhalation routes. It is widely distributed throughout the body, and it is metabolized through the liver. It's excreted through the urine. Working on my survival skills. Some of the pharmacotherapeutics: the adverse drug reactions are hypotension, tachycardia, and throbbing headache. Some of the drug interactions with nitrates are with other drug classes that cause hypotension, anticholinergic drugs that may decrease absorption, aspirin may potentiate the action of nitrates, and the effects of heparin may be decreased with nitrates. Some of the precautions with nitrates are with glaucoma, anemia, volume depletion, and hypotension. Contraindications with this drug include hypersensitivity, increases with intracranial pressures such as head trauma or cerebral hemorrhage. The IV form, you need to be cautious with cardiac tamponade, restrictive cardiomyopathy, and constrictive pericarditis. The pregnancy category for nitrates is C. The clinical use for nitrates is to treat all three forms of angina pain. It also is helpful in some subsets of heart failure where the pathology is increased preload. Some of the rational drug interactions: sublingual, is rapid acting, efficient, easy to use, and low cost. Transdermal is also easy to use, but you do have to remember to tell them to take off the extra patches. There's no monitoring of labs with nitrates. Some patient education when using nitrates is there needs to be a 10 to 12 hour free period with both oral and transdermal routes. You do not use nitrates concurrently with alcohol, and for those that suffer with nitrate headaches, Tylenol is good to treat that problem. When you open a bottle, you need to date it, and after 6 months you need to discard it. Some of the lifestyle management changes is to do slow position changes to minimize any kind of blood pressure problems. Some of the main takeaways with nitrates is with patients with migraine headaches, it is important to maybe start them on a beta blocker prophylactically because they're at high risk for nitrate headaches. Do not use this drug with the the same drugs used to treat erectile dysfunction. Some of the overdose symptoms for nitrates is slow heart rate, vision changes, severe nausea, vomiting, and bluish fingers and toes. And my Dr. Moore meme for nitrates is, I've been told that when I get focused in on schoolwork at home, that I probably can't hear a dump truck drive through a nitroglycerin plant. Thanks for watching.